All right, everyone, we are going to go ahead and cover the respiratory system for our week 7 chapter here. Here's just a quick breathing technique that has been studied quite a bit, actually. And so they have found that this technique really calms the system and does a lot of good things for our system. So it can improve our heart rate variability, kind of how quickly we can calm down a elevated heart rate. It can help your blood pressure, blood glucose, and some other different functions. So I put a quick link to the article, or not link, but the article title itself, and kind of some quick instructions for the technique. So try that out, see if you like it. That's just kind of a fun, nice to know, not anything you need to worry about for studying, of course. All right, so in terms of our respiratory tract, we make two major kind of differences here. We have our upper respiratory tract and our lower respiratory tract. And so the upper respiratory tract is our nose and nasal cavity, our pharynx, and our larynx. So I know the pharynx and larynx are kind of funny looking words. You can almost pretend like you're going to throw an invisible I, the letter I in between our N and X here, but just say it really quickly. So you don't want to enunciate pharynx, larynx, but it's not quite pharynx or larynx. It's the pharynx and larynx. So let me go ahead and get our model turned here. Let's go from this direction. Okay, so this gives us a little better view at the upper respiratory tract. So you can see our nasal cavity up here, also known as our nasal sinus. We have a few different sinuses within our skull or some areas that have space. They're there for sound resonation, and one of the primary functions is that they're going to both warm and moisten the air that we breathe prior to it going into our body. Think our internal kind of set point is 98.6 degrees Fahrenheit. It's rare that our air is going to be that exact temperature. So our cavities and sinuses kind of get our air ready for our internal environment. So past our nasal cavity, now we're going to go almost into the back portion of the throat. That's going to be your pharynx. One other thing that I want to point out, next week we're going to be covering the digestive system. And so our mouth, obviously you can breathe through your mouth, but it's more part of our digestive system than it is our respiratory system. The pharynx, however, is the back portion of the throat, so kind of posterior or deep to your mouth. Going farther down the chain, we have our larynx. So that's going to include your voice box and vocal cords. So sometimes you'll hear that area just referred to as the voice box. And then that is going to be the last structure or segment that is considered the upper respiratory tract. The lower respiratory tract is going to start just distal to the pharynx. It's going to be our trachea. So you may have heard this called your windpipe before. So the trachea is what we use to transport air to our lungs. Our esophagus is just behind the trachea, and that is what our food itself is going to travel down. And we'll talk a little bit later on about a structure called the epiglottis that kind of makes sure that air gets down the trachea and food gets down the esophagus. So I'm going to go ahead and spin our model here. We can just get him towards the end. That's perfect. Okay. So the lower respiratory tract is a little easier to see from this anterior view. So as I was saying, we have our trachea here. When we get to this split off known as the carina, we are going to now call these branches our right and left bronchus. So the right and left bronchus are our major splits off of the trachea. And then if you remember back to our circulatory system and blood vessel conversation, as our vessels got smaller, we added the OLES ending or ULES ending. We went from arteries to arterioles or veins to venules. Similar concept here in the respiratory system. We go from our main bronchus to bronchioles. And there's a few different categories of bronchioles. We're not going to divide them down to the nitty gritty, but more or less our bronchioles are going to be these smaller branches. Our respiratory bronchioles and terminal bronchioles are going to end with alveoli on the end. So alveoli are little small sacs, and this is where our actual gas exchange occurs. And we'll look at these a little closer further along in our lecture. And then if you remember the diaphragm from our muscular system conversation, that is our primary breathing muscle. It gets some assistance from our internal and external intercostals, but our diaphragm is really what is driving the bus here. So our diaphragm is going to drop lower in the thoracic cavity and push up into the thoracic cavity. So that change in position of our diaphragm changes how much space or kind of air availability we have in that thoracic cavity. That's going to change the pressure in our thoracic cavity, and that is going to be what drives inspiration and expiration. All right, so we refer to respiration in two different portions. We have our external external expiration, or external respiration. And so this is the respiration that we think of most logically. So this is going to be the actual exchange at the lungs. So the air is coming in, and we're trying to swap out the fresh oxygen that we're bringing in for carbon dioxide that our tissues got rid of. So our external respiration, it's happening in the lungs and really in the alveoli. And you can remember that's external because we are getting oxygen in and pushing carbon dioxide out to the external environment. So we're getting our oxygen in from the environment, we're putting our CO2 or carbon dioxide out into the environment. Our internal respiration is going to happen at the level of the capillary bed in whatever tissue it's in. So this is where that exchange is going to happen. We're going to have oxygen diffusing out of the bloodstream into our tissues, and we're going to have carbon dioxide diffusing into the bloodstream from our tissues. So that's our internal respiration. All of that is remaining internal. So that oxygen is going to internally remain in the tissue that needs it, and the carbon dioxide for now is going to remain internal until it gets back to the alveoli where we can get rid of it in our external respiration. All right, there's not a ton of concepts to cover for the respiratory system. So the remainder of this lecture, we're going to get some practice with our new word list. As always, we have a new word list. So we have one for this week for the respiratory system, and then you'll also see one for week 8 that will cover the digestive system, and that makes up this unit together. So just 2 lists for this unit. I know it's a lot of words still, but you guys are doing a good job. So we're just going to kind of practice for the most part. We'll talk a little more concept, but most of this will be just some word exposure. So looking at a couple of our new combining forms, our nase/o is for nose. We already saw rhine/o for nose as a combining form on our previous lists, and you'll see a couple examples where we have multiple combining forms for one definition. You'll see for our pharynx here, we basically just drop the X, add a G. So instead of pharynx/O, we have pharynge/O is going to be our combining form. So obviously all 3 of our words down here deal with the nose. So our suffix plasty is going to be surgical repair. So a rhinoplasty is surgical repair of the nose. If someone gets a nose job or plastic surgery, that's what you're going to ask for is rhinoplasty. Rhinorrhea, that's going to be our fancy word for a runny nose. So that's rhinorrhea. So RRHEA, rhea, that suffix is for discharge. And then the rhinovirus is a group of viruses that are better known as the common cold, but they often cause sneezing, runny nose, itchy nose, so they have been named the rhinovirus group. Epistaxis, that is the medical term for a bloody nose. So you see that here, that's epistaxis. Sinusitis. Sinus is a super easy one to remember for your new word list. Sinus is our root for sinus. So sinusitis is inflammation of our sinuses. And then last but not least on this slide, we have olfaction. So I'll give you a hint. When you smell something, we have nerves called our olfactory bulbs that detect it. So olfaction is going to be the process of smelling. So if you are smelling something, that is olfaction. All right, let's keep it going with our new words. So I'm going to go kind of top to bottom. So tonsillo is our combining form for tonsil. We have palate/o. That's going to be our palate. So you have your hard and soft palate in the mouth. If you put your tongue to the roof of your mouth, that is your hard palate. Epiglot, I mentioned that structure, the epiglottis, earlier. So your uvula, uvula, your uvula is the little punching bag in the back of your throat. So that's not what we're talking about. Our epiglottis is not really very visible, but its job is to cover the trachea when we are eating so that food goes into the esophagus. We'll talk about another word called aspiration when food goes into the trachea, meaning it's going to end up in your lung rather than your stomach. So your epiglottis's job is to prevent food going into the trachea and lungs, and that's our combining form. This CH is not a ch sound, but a k sound. So Kyle or keel/o. So that is our combining form for lip. Bucc, B-U-C-C, is our combining form for the cheek. Gloss is our combining form for the tongue. And lingu is also a combining form for the tongue. Like I said, there's going to be a few combining forms here for the tongue, the mouth, that in a sense are duplicates, but also oftentimes are kind of swapped out for one another depending on the word. So as always on a test, I try to make sure that if there's any duplicate roots or words and you answer that, you still get credit for it. So don't worry too much because there's not really any difference in the definitions themselves. Sorry, I realized I jumped the gun there a little bit. So nasopharyngitis, that's our first practice word. So this is a good time to go ahead and take a quick pause, see if you can get the definition for these 7 words here, and then restart your lecture when you are ready. So our first 3 words here all end in itis. That's our favorite suffix by now. We've seen it the most probably. So that is going to just mean inflammation. So nasopharyngitis versus pharyngitis. Obviously, the only difference here is that we have an additional combining form, our nas/o. So that's going to be inflammation of the nasal cavity and our pharynx. So that's kind of the back of the throat there. Pharyngitis itself, that's showing her picture right there. That's just irritation of the throat. And then tonsillitis is irritation of the tonsils themselves. And typically for people who have chronic tonsillitis, that is going to be the people that have had their tonsils removed. Moving on to our next column, here we have a nice and long word, good practice for pronunciation, palatopharyngoplasty. So palatopharyngoplasty. So that's going to be the palate and the pharynx getting surgically repaired. So surgical repair, let's always start with the suffix, surgical repair of the hard palate and the pharynx. Ankylosing, so our term IA is just a condition. Our root here, ankle, is for crooked or bent. Stiff is another definition for that ankle, that first half of our word. And then gloss is our word root for tongue. And really, I missed a combining vowel here. It should be ankyloglossia, which is a crooked or bent tongue. Sublingual is a very common way to take some medications. So AL is going to be our suffix for pertaining to. Our prefix sub is going to be below, and then lingual or ling is one of our combining forms or word roots for the tongue. So if I take a medication sublingually, it's going to be taken below the tongue. Nitroglycerin is a very good example of this for prevention of heart attack. Buccal, we said BUCC was our word root for cheek. So buccal is just going to be pertaining to the cheek. Moving further down, so we have the larynx, which is part of our upper respiratory tract, and the trachea, which is part of our lower respiratory tract. Remember, the larynx is the kind of voice box vocal cords here. The trachea is our windpipe where air is going to flow down. The laryngeal, just referring to the larynx as a location. Laryngitis is going to be inflammation of the larynx. So when a singer says they need vocal rest, they're typically trying to prevent a bad case of laryngitis. And a laryngoscope is going to be an instrument that we can use to visually view, to view the larynx. Tracheostomy. So remember, if we got rid of that S, if we took out this S here, and it was tracheotomy, that would just be an incision into our trachea. Since we add that S, we have tracheostomy, which is going to be an intentional surgical opening within the trachea. So have you ever seen any of those crazy survival movies where someone takes a pen and kind of takes it apart and then stabs the stem of the pen into someone's throat to let them breathe? They're performing a tracheostomy in the field. They're trying to create an airway or opening to our airway. I missed one here. I'm sorry about that, guys. And so we'll skip down to tracheobronchitis. So that's going to be inflammation of both the trachea and our bronchi. Doesn't specify right or left. These couple of terms up here are somewhat nice to know in terms of croup and stridor. Both of these are going to be lung sounds. So stridor is kind of a high-pitched wheeze on inspiration, and then croup is a like a barking cough sound, so a very high-pitched, shallow cough, which is associated with infants. So don't need to know those for the test specifically, but there's a couple other sounds tucked in throughout. The reason I include them is because when you're listening to a patient's breathing, this is some of the things that our doctors are listening for, because some of these sounds correspond with specific issues or diseases that may be occurring within the body. Dysphonia, we should be able to kind of figure out with our terms. So PHON is going to be our root for voice. So you can think of it as sound, but voice is really a better definition for it. So PHON, phone, is going to be sound or voice. So we saw echo in previous lists as sound. When you see PHON, this phone/O for our combining form, that is sound specific to our voice. All right, let me point out this middle section first. This is another good example of why we want to keep paying attention to the differences in small details. So our bronchi, or our bronchus, is going to be this word root here. Bronch, sometimes they add the I and O, kind of a double combining vowel. So just bronch or bronchi. If it's bronchiole, adds that OL, then we're talking about the smaller branches, bronchiole. So the example here, we have bronchitis versus bronchiolitis. So bronchitis in our bigger bronchus, bronchiolitis in our smaller branches. So bronchoscope, just like the laryngoscope, it's going to be an instrument that we can use to view the bronchus. A bronchodilator, we see the kid here getting a nebulizer treatment. So for people with asthma or CEF, which is cystic fibrosis, or some other diseases that affect the lungs, it's very common to be on a medication that is a bronchodilator. So think about it for a second. Would a bronchodilator make the airways wider or make the airways more narrow? Good. If you said the airways would be wider, good job. Remember, dilate is going to be to get wider. So we see that with our pupils. We see that with our blood vessels with vasodilation versus vasoconstriction or bronchoconstriction, which would be to make more narrow. So a bronchodilator is going to make it easier to breathe. Bronchiectasis. So again, we know this is going to include our bronchi or bronchus, but really what it is an infection. And it's an infection of our bronchi and bronchioles, and it causes some really gunky mucus and pus to build up, making it a lot harder to clear our airways out. So bronchiectasis is a infection of the lung and bronchioles that is associated with cystic fibrosis, especially. All right, this is the only other part of the lecture where we're going to talk a little bit more concept and physiology. So we're going to do a little bit of a zoom in on our alveoli here. So you can see our lower respiratory tract here. We have our trachea, the carina is the split. So then we go to a right and a left bronchus. We have our bronchioles. And so if we take just one branch of this bottom section here, now we're here. So we have a terminal bronchiole. So that means it's kind of the end of the chain. And off of our terminal bronchioles, we are going to have respiratory bronchioles. They're called respiratory bronchioles because they contain our alveoli, which are our structures that we utilize for gas exchange. So we have our alveolar sac, that's kind of this entire structure, and then each individual segment is known as an alveolar pore. You can see the illustration here shows the capillary bed right on the surface of our alveoli because that's where the gas exchange is going to occur. So this is showing the air movement and our blood movement. So remember, if you think from our heart chapter, the section of our heart that sends blood to the lungs is going to be our right ventricle. Our right ventricle is going to pump deoxygenated blood through the pulmonary artery, and that is going to cycle into this first of our alveoli. So we have our deoxygenated blood waiting here for our new air, which is rich in oxygen, to come into the alveoli. And so that oxygen is going to diffuse into the deoxygenated blood. Our blood has now picked up oxygen, so it's going to drop off its waste or carbon dioxide. And so that carbon dioxide is then going to be expired. When we exhale, we're going to push that back into the environment. And now our blood is fully oxygenated, and it's going to go to the pulmonary vein, which empties into what chamber? Correct, the left atrium. So we have this is showing our external respiration. Oxygen coming in, oxygenating our blood, carbon dioxide is getting dropped off and going out. We have oxygenated blood going back to the body. So alveolar is just referring to the alveoli themselves. Hypoxia is our term for not enough oxygen in the body's tissues. So what suffix could I change out for our IA? If I left hypox and I took off IA, what new suffix could I add to make this specific to not enough oxygen in the bloodstream? So the suffix I was looking for was emia. So emia is specific to a blood condition. So hypoxia is just generally not enough oxygen in the body's tissues. Hypoxemia is not enough oxygen in the bloodstream. So our image at the top here shows a normal alveoli. You can see it's nice and open here. It's got really clear borders. The lines here aren't overly thick. And now we're going to look at a lung with emphysema. Emphysema is one of the two pathologies that contribute to COPD, chronic obstructive pulmonary disorder. And so one of the concepts that's not as easy to kind of grasp when we think about emphysema and COPD is that they're having trouble getting enough oxygen or air in, but it's really because they can't get the old air out. So with emphysema, it's a disease that kind of attacks the walls of our alveoli. And so just like anywhere else in the body, when we have damage somewhere, we're going to lay down a lot of scar tissue. And so when our alveoli have all this kind of scar tissue and tougher tissue, they can't expand and contract with the air like they need to. And so air gets trapped. If old air gets trapped and we've already taken the oxygen out of it, it's not really doing us any good. So if you see here, we have a lot thicker lines, not nearly as clear of an opening. So it's going to be a lot harder for that gas exchange to occur. Here's a couple other sounds that are associated with different lung pathologies. So rales are also known as crackles. So it almost sounds like stepping on gravel, or if you take a piece of plastic and kind of crinkle it in your hands, that's rales. So that's typically going to be some type of fluid or mucus in the alveoli or the terminal bronchioles. And then we have rhonchi, and that's going to be wheezing when we are breathing out. So again, nothing super important, just kind of nice to know information especially for those of you that may be interested in nursing or one of the other healthcare fields. All right, just a little bit more practice here. So we have a couple different combining forms here. Pleurer, so our pleural cavity has the space where our lungs are. And so our pleura, we have a visceral pleura and a parietal pleura. That's going to be the two membranes, the serous membranes that cover our lungs. So remember, our visceral membrane is always directly on the lungs, whereas the parietal membrane is going to be that outer layer. In between our two layers, we are going to have the pleural space where we have pleural fluid. This is showing we have our visceral membrane here, our parietal membrane here, and the space between the two is our pleural space. So this is showing kind of a normal lung, should look like this. This is showing an infection where pus has gotten into our pleural space, and we call that an empyema. So if that pus builds up enough pressure, it can cause issues with inflating or even leading to a fully collapsed lung. LOB/O, that's combining form for one of the lobes of our lung. So our lungs have a few different lobes to them. And so LOB/O stands for lobe. And even though the E is dropped off, we're still going to pronounce that as lobe versus lob. Thorax/O we saw in the thoracic spine, but it also refers to our thoracic cavity or our thorax. That's the upper part of our anterior cavity. Remember, our dividing line is the diaphragm. So everything below the diaphragm is abdominopelvic. Everything superior to the diaphragm is going to be our thoracic cavity. Pneumon, and pulmon are all roots for the lung. So you'll see the lung in a few different versions on your word list. Looking here at this kind of left center column, this just shows a few different breathing rates. So normal breathing would be called eupnea. So PNEA is our root for breathing. So EU is our prefix for normal. We don't see that one super often. So eupnea is going to be normal breathing. For dyspnea, that's going to be slow breathing. Remember, Tom Brady is slow. Brady is our prefix for slow. So bradypnea is going to be when we drop below 12 breaths per minute. Vice versa, tachypnea is going to be faster than 20 breaths per minute. And hyperpnea is really when we're hyperventilating. So deep breaths, but breathing super quickly. So you see the amplitude of our lines show the depth of our breath. And then sighing is very similar to what you think about if you were going to sigh on purpose. So if you think of a sigh, you're doing kind of a deep breath in, blow it out. So this sighing is not necessarily intentional. It's when we get a few deeper breaths kind of randomly interspersed within our normal breathing. Okay, here's some terms associated with pathology of the lungs. So atelectasis, this is going to be a partial collapse. So you'll see the root atel on your list. And so atel means improper or really imperfect or incomplete. So atel or atelectasis is going to be a partially collapsed lung or at least collapsed alveoli. So the lung is still functioning. There's just portions of it that have collapsed. And then that is matched with your suffix ectasis. That's another one that's on your list this week. And so ectasis is going to be a dilation or expansion. So atelectasis is an incomplete expansion of the lung in the alveoli. Expectoration, that's the term for basically coughing up or spitting up mucus or any other substance. Hemoptysis, that's going to be our term for coughing up blood. So if someone's saying they're experiencing hemoptysis, so hemo is for blood, hemoptysis is going to be coughing up blood. So that suffix ptysis, I said that hemo part, the beginning part of the word is your combining form for blood, and that ptysis is the suffix for spit. Legionnaire's disease, also known as pneumonia most commonly, it's mostly bacterial. You'll see this is normal lungs. It's space, so it really shouldn't light up on our x-ray. But if we have a bunch of junk in there, it's going to show up quite a bit. So that's a set of lungs with bacterial pneumonia. So pneumonia is an infection affecting the lungs. If you saw the word pneumonitis, that's going to be inflammation of the lung rather than just an infection. A lobectomy. So remember, our suffix ectomy is surgical removal. That's going to be the surgical removal of just one lobe of the lung. That's pretty common in lung cancer. Pleurodynia. Dynia is our suffix for pain. Pleur is our suffix for that pleural membrane. So this is going to be pain due to the covering of the lung. Pleuritis and pleurisy are the same thing. So pleuritis, if we're looking at purely from a definition standpoint, is going to be inflammation of the pleura or that covering. And then pleurisy is just kind of the term they use for the actual diagnosis of pleuritis. A pneumonectomy, so this is going to be actual removal of a lung. So they can do lung replacements now. Just an FYI, they have replaced one or both lungs for people. And then a pneumothorax, that is going to be a collapsed lung. So that is when there's some kind of leak in our lung. Air is going to leak out into our thoracic cavity. That air has nowhere to escape. So it's going to start building up pressure in the thoracic cavity to the point where it's going to force our lung to actually collapse. So that's a pneumothorax. All right, last couple, we're just going to do some practice. So go ahead and pause the video, see if you can get your definitions down, and then restart when you're ready. So our first few words we see, we have the root nia in common. So remember, that's going to be our root for breathing. So apnea, that A means lack of or without. So lack of breathing is apnea. Dis is difficult or painful. So that's going to be difficulty or painful breathing is dyspnea. We said our prefix EU is for normal. So eupnea is going to be normal breathing. Orthopnea is going to be breathing when standing. So ortho means straight. So that's going to be standing straight up. Asphyxia, this is from your additional terms list. This is going to be lack of air or oxygen due to the lack of air or oxygen to the brain because of a disturbance or physical barrier. So typically this is going to be from choking. It could be from a blood clot, some kind of barrier preventing oxygen getting to the brain. Aspiration, I mentioned briefly earlier. So if food or liquid, some kind of solid does get down the trachea into the lungs, we call that aspiration. So that's when the epiglottis didn't quite block the trachea off. And then inhalation, inspiration, or exhalation, expiration is going to be our terms for breathing in and breathing out. One last round of practice here. Oop, I went a little too fast, guys. Don't look. Okay, so pause here. Try to get your terms down, and then we'll finish up with our last slide. Okay, anoxia, we see that AN prefix. So remember, A and AN are both without or lack of. So that's going to be a lack of oxygen. Capn, or CAPN, that is our root for carbon dioxide. So that is going to be excessive carbon dioxide is hypercapnia. Our suffix raphy here is going to mean suture, and pulmon/O is a combining form for the lung. So pulmonaraphy is going to be a suture of the lung. Bronchiostenosis, our suffix stenosis is narrowing. This is a good example where they throw that I in. So that's narrowing of the bronchus. If it was bronchiolostenosis, then we could say it's bronchiole. So it doesn't have that L added in there. So it's the main trunks, the bronchi. Respirography, our suffix graphy is going to be recording, where our root respire is going to be breathing. Sorry, I lost my spot for a second. Diaphragmatoplegia. So another mouthful of a word there. So plegia we've seen previously. That is the suffix for paralysis. And then that long root there, diaphragmato, is our combining form for the diaphragm. Adelospirosis, so osis meaning abnormal condition. Remember, a tel is our imperfect or incomplete. SPIR is going to be breathing, so improper breathing. So they're not taking complete breaths. It's imperfect or incomplete breathing. And then last one on here, you may not have been able to get, but that's frenectomy. So the phrenic nerve, PHRENIC, the phrenic nerve is the nerve that supplies our diaphragm. So this root here, phren, PHREN, is also going to refer to our diaphragm. So frenectomy is cutting out of the diaphragm, but diaphragmato is what you would see on a test. So that is the respiratory system. That is our only lecture for this week. And next week, we will go ahead and cover the digestive system. Have a great day.